When we talk about affordability, we talk about in distance to get the space and accessing doctors and pharmaceutical services. When we talk about access, we talk about to get there from various points, especially because clinics and health centers are assigned to various communities, all persons including LGBTQIA folks accessing the space, persons living with disabilities and other healthcare conditions that affect their access. Quality service provided to potential clients, from frontline workers to healthcare works and other personnel at healthcare spaces, including hospitals, clinics and private facilities as well.